In a troubling shift, Black residents of Los Angeles County now have the highest risk of coronavirus infection and COVID-19 hospitalizations and death of any racial or ethnic group, new data show. Since the first few months of the pandemic, Latinos in LA County have been the hardest hit group. The COVID-19 death rate among Latino residents surpassed that of all other racial and ethnic groups for the first time 11 months ago and remained in the lead for both the second and third waves of the pandemic. But in recent weeks, there's been an unmistakable shift, and now Black residents are twice as likely as Latinos and 3 times as likely as white and Asian American residents to die from COVID-19. Black residents are also twice as likely to contract the coronavirus than white or Latino residents of L County, according to data presented by the Department of Public Health. Over a recent 6-week period, there was a daily average of 45 newly diagnosed coronavirus cases for every 100,000 Black residents. Yet for every 100,000 white and Latino residents, there were roughly 25 newly diagnosed coronavirus cases a day among those residents, and for every 100,000 Asian American residents, there were 11 new coronavirus cases a day. In terms of COVID-19 deaths, for every 100,000 Black residents, there was an average of about 1 death a day among Black residents during the same period. By contrast, for every 100,000 Latino residents, there were about 0.5 deaths a day among Latino residents. For every 100,000 white and Asian American residents, there were 0.34 deaths a day among those residents. Those rates are far lower than during the peak of the pandemic. Daily coronavirus cases overall are still declining in L County and are at their lowest levels since March 2020. The most recent coronavirus positivity rate for L County is a minuscule 0.5%. Nonetheless, the latest data are a warning sign of what could come if vaccination rates do not dramatically improve among Black residents. Just 40% of Black residents 16 and older have received at least 1 dose of vaccine in L County, the lowest percentage of any racial or ethnic group. Among similarly aged Latino residents, 48% are at least partially vaccinated, as are 62% of white and 71% of Asian American residents. Who is getting infected and who is in the hospital is likely a reflection of lower rates of vaccination in some of our hard-hit communities. This is going to mean that we have to continue to both bring vaccine to the places where people live and work, and we need to work hard to get high-quality information about the vaccine to those with questions about the vaccine safety and effectiveness, L County Public Health Director Barbara Ferrer said. The relatively lower vaccination rates among Black and Latino residents have long been a warning sign for officials.